everyone. Welcome to today's Health Scrutiny Committee. So, thank you everyone for being here on time, ready to rock and roll. Item number 1, minutes of the last meeting held on the 16th of January 2024. Can I accept they're a true record? Everyone okay with them? Great, all okay for sign? Great, thank you very much. Number 2, apologies for absence. Catherine, have you got any apologies? Everyone's here, looks safe. Right, thank you very much. Item 3, declaration of interest. Is any members present got any disclosable pecuniary interest to declare, or any private interests? That's ready.
My husband's a community staff nurse who used to work for Nottinghamshire Healthcare.
Thank you. Noted. Anyone else? Councillor Walsh?
I'm about to become a school governor in a local authority maintained school, and since we're talking about mental health provision in school, I just thought for complete
thank you very much.
transparency, I better make that clear.
Councillor Wilmot?
Yeah, I think it's. I think it is an interest because we're talking about schools. That my son is a head teacher at a school, so I think it's essential.
Yeah.
What I do.
Yeah, thank you very much. Councillor Grant?
Well, I'll declare it as I always do. Obviously, my daughter's trained to be a nurse, so I know it's has no impact.
If you're not sure, declare it. Absolutely.
Yeah.
Anyone else? Okay, thank you.
Just repeat that. Sorry.
Sorry, Director, it's marking the yellow panel.
If you use your microphone, please.
Just the recording, that's all. Thank you.
Director at Sparkhill Academy.
Yeah, thank you. Got it.
Yeah, Rivendell Flying High. I'm a governor there.
Thank you. But everyone's got an interest, so good job we can vote on the item, otherwise it could be an interesting one. Okay. Everyone else? No, thank you then. They're all noted for the minutes, thank you. Right then, so on to the substantive, first substantive item of the agenda, which is Nottinghamshire support for the mental health provision in school. So first of all, hopefully everyone's got the note that Noel sent around yesterday for the briefing note that I requested from the Healthcare Trust before we get into this item here today. So obviously, I think everyone will join me in being concerned by recent events coming out of the Healthcare Trust in terms of the Section 48 review that's obviously being commissioned to go in place with Secretary of State and with the NHS England doing their independent review. What I propose is that, and the minute while the review is going on, we should let that review process take place independently with CQC, and I know it's due to be published end of March. So what we propose in the work programme is that potentially we look to bring forward an item to scrutiny as soon as possible after that review is concluded to look at the outcomes of that review and any actions this committee might want to take given the impact on healthcare in Nottinghamshire. I have met with colleagues in the ICB to chat about the item as well, and I do appreciate them sending that note through as well about it. But I think, like I say, what's really important is we let this independent review take place to bring out everything that might be of issue to go through, and then we go forth from there given the short time scale at the end of March. So I'll invite comment on that when we get to the work programme itself. So I want to set out before this item now to say that's the actions that we've gone through so far. And obviously with this item being focused on schools, hopefully we can try to keep to the item itself, and more happy to discuss the other issues that will come through the notes when we get to the work programme in terms of how we take that forward. So then, on to the item itself. So I'd like to welcome Louise Randall and Carl Jones from Nottingham Healthcare NHS Foundation Trust, Maxine Byrne from the Nottinghamshire ICB, and Catherine Brown from Nottingham County Council to the meeting. So thank you very much for coming today, and hand over to yourselves.
Thank you. So, Catherine Brown, Senior Public Health and Children's Commissioning Manager. I work on behalf of Public Health in the County Council and the Integrated Care Board, and I'm going to start to take us through the presentation. So thank you for the opportunity to come today to talk to you about mental health support teams in schools and the provision that we have in Nottinghamshire. We're of the understanding that committee papers have been reviewed, so that we will try to provide additionality to the report that you will have received in advance of this meeting. So mental health support teams provide support for both children and young people within our schools in Nottinghamshire. They also provide provision and support to the wider network, so those working within the schools to ensure that we've got effective provision in order to provide early intervention and early support to our young people. We know that if we intervene early and we provide that robust support, we can make a real difference and ensure that we try and prevent problems that can develop later in we know that the most common presentation that our young people present with is anxiety, and therefore the Healthcare Trust have developed interventions which are clinically effective in supporting young people with anxiety and the other presentations that they present with. Mental health support teams have been funded by NHS England originally, and as a local partnership consisting of the Integrated Care Board, Healthcare Trust, Public Health, and in partnership with education colleagues, we've competitively bid for resources in Nottinghamshire. I understand that we were the first area to successfully mobilise a mental health support team in school, and we have been successful in all bidding opportunities, which have been competitive. So our first mental health support team initiative began in January 2018, and at that time NHS England pre-selected areas which were able to bid for schools. So at that time Gedling and Rushcliffe were the areas which they selected from their predefined criteria, and that was the first teams that we mobilised. Since that time, as a local partnership, we have worked collectively across health, health provider, Notts Healthcare Trust, the Integrated Care Board, and Public Health, and with our education colleagues to select which areas would be best placed to adopt mental health support teams in schools, noting that probably every area would really welcome mental health support teams. When we've been making that selection criteria, a wide range of factors have been considered across the partnership. So that has been around using the phased mobilisation of mental health support teams as a way to test out mobilisation in each area in the district, to gather learning and information about what mobilisation has been successful, to try and prioritise those areas within a district with the greatest need, and working with colleagues to look at indicators such as number of young people on child protection plans, safeguarding assessments, those young people that are eligible for free school meals. At the moment we've got coverage across the districts, and going forward we would absolutely welcome an additional focus in areas which do have higher deprivation, so that would be Bassetlaw, Mansfield and Ashfield. Mental health support teams are available in addition to all the other support that is available through universal services, so thinking about 0 to 19 mental health offer, in addition to CAMS and other provision, so they do provide that kind of additional opportunity for extra resource for schools. I'm still on this one, but I will give Noel a nod. So it should be noted that when the opportunity to bid arose, at that time Bassetlaw primary schools had access to a resilience programme. So when we were prioritising schools, secondary schools were prioritised in Bassetlaw because there was some support available through a resilience and mindfulness training packaging. That provision has ceased now, but the schools have had the training. So again, going forward, Bassetlaw would be an area that we would be putting forward in terms of an area to be prioritised. Unfortunately, we weren't invited to bid at the last NHS England bidding round, and we understand that that's because as a local area we've actually got really, really good coverage that is higher than other areas. We continue to ask and kind of advocate that as a local area we've been shown to mobilise mental health support teams really successfully, and that we are kind of afforded the opportunity to bid in future waves. We absolutely aspire to 100% coverage, that would be our local ambition, and we're awaiting information from NHS England on when there will be future opportunities to bid. If we go to the next slide, please. So this slide gives you a little bit of information about the coverage when all of our current mental health support teams are mobilised by district. This is the coverage that we will have, and as we've kind of articulated in terms of further bids, we're really ambitious about providing additional support in those areas which do have high levels of deprivation. Currently, mental health support teams were originally funded by NHS England, but existing teams are now currently funded from the Integrated Care Board. And then if we go on to your next slide.
Hi, Carl Jones. I'm the Service Manager for the Mental Health Support Teams for Nottinghamshire Healthcare. So in this slide, this provides a flavour of the things that we offer to children and young people, which is preventative support provided within the school environment. So this is some stuff that we've done in the last 12 months. CBT one-to-one, that's cognitive behavioural therapy. It's an evidence-based therapy that we do provide, which is really good response to anxiety and other presentations, such as emetophobia, which is sickness phobia. That's something that we found a large increase post-COVID, and also OCD in a mild form. So we do a lot of assessments as well. So all young people are assessed initially to determine what would be best for them. Parenting interventions, one-to-one or group, these have been particularly successful, and it is around widening this out. So it's the support that we offer is not just about within the school environment, it's about supporting parents outside of school to support the work that we do. Otherwise, it's a bit like putting a sticking plaster on. Things have got to be like wraparound care and stuff. Other evidence-based practices that we've provided, the parent-led CBT group, which is really good, so supporting parents to then support themselves, and this is something that we do with young people as well, kind of co-production, but kind of teaching them to lead their own recovery, and we found that this is particularly effective with young people, peer mentoring support and stuff, but also parents as well. We've got some really fantastic feedback from people around how effective that is. The ending discharge sessions are really important, so it's not just about goodbye, it's about, okay, what have we done, what have we learnt, how can you hang on to this stuff and integrate the support that we've given you to overcome challenges that you may face in the future. Worry management, which is kind of like pre-CBT really for anxiety, but it's certainly very popular for little children, so more kind of primary school ages. The risk assessment session, so again, that's if what we discover from people's presentations that it would be more that would be expected to be provided by early intervention. So this would be supporting a referral into CAMS or to get some crisis support where appropriate. And then graded exposure is something that is done within the school, but also outside school as well. So it may be a fear of crowds. It may, and again, this was something that we found a lot of post-COVID about children and young people really kind of being almost paralysed, not wanting to go outside the house because they may be frightened of germs or other people and stuff. So graded exposure is just like a kind of baby steps, you know what I mean? Just and see how it goes, and then kind of challenge those thoughts. Because some people just, young people can be, get into catastrophizing everything. So it's kind of like, no, I can't do this, I can't do it. And it's kind of like, well, we can, and let's do this together, and let's just try one step at a time. Next slide, please. Thank you. So on average, we saw 3.4% of the referable population in any given year for one-to-one interventions, which equates to 1,632 young people. Although this may seem like a very small number, this is comparable with young people accessing community CAMS, and is only part of our offer. Okay, so there's the one-to-one work, and then our whole school approach, which really is the backbone of the mental health support team offer, because it's about integrating mental health, emotional intelligence, and just the whole conversations around how am I doing, how am I, what are my thoughts like, and it's integrating this into the school environment within school assemblies, supporting teachers, and then bringing parents and carers in as well. So it is a whole school offer. To that end, in terms of assemblies, peer mentoring support, audit, which is where we speak to and have meetings with schools to determine what they think would be helpful for them. And the workshops that we offer are without referral, so this is just something that we offer into schools. To that end, we've offered to 26,000, well, nearly 27,000, but it equates 56% of the referable population. We've also supported nearly 2,600 members of teaching staff who've attended training and mental health workshops provided by us, and the premise of that is around, some of it is around support, around how is it being a teacher, because we know that teachers are really stretched and stressed with their own agendas, but it is around what is it like supporting, a class full of 40 kids where there's lots of anxiety and concerns and worries and stuff. We also have direct links with community and specialist CAMS, and although I am the service manager for the NHST, I'm also the service manager for community CAMS within Nottinghamshire Healthcare for the county. So those direct links and link meetings that we have on a weekly or fortnightly basis are where we're able to identify kids that might want to go up the chain or even come back down the chain, or also providing support to the mental health support staff. So 6.6% of mental health NHST cases discharged since 22 to date had a direct transfer to community CAMS, equating to 155 cases, of which 155 of these, 85 were first assessed by the NHST, and the other 70 were immediate transfers. And just to kind of explain that a little bit, it's just kind of like the pathway. So if we didn't have those links, that would mean like a separate referral and a delay. Whereas because we are kind of like a whole children's mental health family, it's much easier to transfer. We can spot somebody, like school nurses used to do many years ago. We can spot people and identify where they may need to go in the overall pathway. Next slide, please. Oh, it's much nicer on there because it's in colour. Mine's just black and white. But I think here what we can see is that routine outcome measures are really, really important. So it's not just ticking the box to say this is what we've done. We actually use measures which are published by the Child Outcome Research Consortium, which is part of the Anna Freud project in London, specifically measures to get feedback from young people to determine whether what they are receiving is of help. And the feedback that we get is from them. So this particular outcome measure here is measuring impact. So we can see initially, right when we first see them, we can see on the third column there, which is some noticeable problems. Between obvious problems and noticeable problems, we can see that in the final one, where we have a paired data, that there is clear improvement there. As well as these, we have session rating scales, which is about the young person giving feedback around the session and the support that they've offered, and also outcome rating scales as well around how things are in their broader life experience. Thank you. Next slide, please. In terms of innovation, of course, NHST is still very much establishing itself, even though we've been around for a few years. We started off with the Trailblazer, which, as Catherine mentioned, was Gedling and Rushcliffe, and then we've gone to Mansfield and Ashfield. It takes a year to kind of get a team established because we have to recruit people, then we have to go to university. So it takes time, and we're building those relationships with schools and stuff. However, we have also developed a peer mentoring scheme, which is training young people to support their peers and their mental health needs and their emotional development. And this training cascades as the movement grows, and it really is co-production of value in action. So it's not just talking about what we do, it's actually getting young people involved with that movement. And it is really exciting to see young people develop emotionally and then to be able to explain this to their peers, and it just cascades. It is a really joyful initiative. The MBCBT, which is a bit of a mouthful, mindfulness-based cognitive behavioural therapy, provision to support to school staff and parents and carers with young people's group in development. Again, very popular and very focused on self-support. So, special educational needs, anxiety course, I guess this is an example of where we have listened to schools, noticed that this particular cohort have individual and particular needs, and where we have developed with those complex difficulties, including the neurodevelopmental needs plus anxiety, because there is a lot there. And I think if you just go in with like one model, that's only going to work for a certain amount of people. The special schools provision. So again, we adapt our core model. And an example here with St Giles at Bassetlaw, we recently delivered and developed a bereavement workshop based on need. There's been a lot of bereavements, and I think bereavement is a specific thing that young people experience for the first time in childhood and can be really impactful. And I think with the added complications of neurodevelopmental processes and understanding cognitive processing, it's really important to listen, digest, reflect, and build together. So again, that's more another example of co-production. And again, with this, we sought training through the Anna Freud National Autism Programme to support staff to be able to understand the difficulties that are being brought. Next slide, please. So this is quite joyful, really, and I know I could have put 5 or 6 or 7 pages of feedback regarding the MHST, and I think it's just testament to the whole project, really, in terms of how well this is received. Okay, so the first one is from a girl aged 10 years old. And things have been really difficult outside of school, with an uncle passing away, and then the child and mum losing their home, which is an incredibly worrying experience for a young child, but the whole family. But again, after support around bedtime and really kind of looking at basic things, not trying to fix the world, but trying to fix what was possible. We got to a place where she was just really happy and, slowing things down because her thoughts were racing and all the rest of it. But she was so happy. She did actually write a poem, which I did have, which I really wanted to put onto a slide, but I saved the slides because I've run away with themselves. But it was great. Again, the feedback that we provide to the carer for this one was really, really helpful. Of course, the therapeutic relationship itself is confidential, and confidentiality is a really important factor for young people opening up with us. Of course, we explain the barriers there around confidentiality, around safeguarding. We think that we're really, really worried that we would be telling other people. But to provide feedback to a parent who kind of felt a little excluded, wasn't really quite sure what was going on, seemed to be helping and stuff. But again, it's that joined up working, which was really helpful. This is a really simple one. Yeah, the biggest help was just having somebody I could talk to and who I could trust. And again, that the bedrock of that is the therapeutic relationship and the confidentiality. I strongly believe the Trailblazer was a step forward in driving early mental health provision towards in our school. That was a head teacher from a school in Rushcliffe, and just recognising bringing the mental health agenda into schools was very welcome and very progressive and very supportive. Another parent who was very, very happy to share their experience, and the strategies have really supported. And I remember this particular parent said we've got him back. We thought he was lost, but actually, from, I think it was 6 or 8 weeks of intervention with strategies. And to be fair, the young lad really did buckle down, did his homework, and really got from this what he did, which was very positive. And then the final one is this person just kind of saying how happy they are that they can do stuff. They don't get angry like they used to, they still get frustrated, but we were able to support them in their cognitive processing to understand that, life is tough and challenging, and actually there have to be different strategies than just getting angry and lashing out. Next. Or is that back to Catherine now? Thank you.
Just to wrap up, in terms of this slide, this was to reinforce, I think, the partnership approach that Carl has spoken to, about that really close joint working with schools, with education colleagues. The mental health support teams have been shortlisted for a number of local and national awards, and at the heart of that has been the partnership approach that's been taken, and I think that's why the national evaluation speaks highly of the local mental health support teams in terms of their performance, with schools saying that they are very satisfied with the provision that's been made available to them. I think that, coupled with what Carl's spoken to about the increased clinical outcomes that our young people receive, testament to the effectiveness of the teams and that partnership approach to planning and mobilising new teams. In terms of governance, mental health support teams and all areas of transformation we have a children and young people's strategic partnership group for children and young people's mental health, and that's chaired by a public health consultant, and that receives regular updates and reports on mental health support teams, but also other areas of transformation. What we do work to strive to do is to co-produce. Carl's spoken in part about that, but working really closely with younger people on all areas of mental health transformation, ensuring that we're listening to their voices, and that's reflected in the services that are delivered. I think the other thing to note on this is, though the mental health support teams do require a level of lead-in time for mobilisation, what that affords us the opportunity to do is to grow the workforce, to train new people, to embed them within our local system. So we are, in real terms, growing the workforce, not moving people from other teams, which is really, really important when we want to increase that provision that is available. Next slide, please. So in terms of our next steps, we are really keen to ensure that we are ready for further opportunities to bid for mental health support teams. We've got that good steering group network who's able to work together when opportunities do arise. We are committed to maintaining the current mental health support teams that we do have, and looking at how we can strengthen support for those areas that perhaps don't have access at this time. What they do have is access to the whole school approach offer, which is led by the Tackling Emerging Threats team with a whole school approach lead and all other services, but we're keen to look at how we can strengthen that in the absence of all teams having a mental health support team, and to review feedback from our locally commissioned review that we are having into mental health support teams, as well as the national evaluation. We've commissioned that local review, and ultimately continue to hear from young people, parents, carers, schools, and develop our local model. And that's it from us.
Thank you very much for that comprehensive presentation. That question, I think it's.
Apologise for being late, Chairman. I was sat downstairs in the office and didn't realise it started at 10, but there you go.
I know why you head up, no problem. We can catch up later with any bits in there. So Yeah, thanks, Councillor. Got that noted. Yeah, so again, thank you very much for that presentation. I mean, I've got many questions, but obviously I'll touch a couple now and come back to the end when the rest of the group come round. I think my initial thoughts are looking at the presentation and the work I've looked at that's been done so far is what we're actually doing in the school to get to is very good. You know, in terms of looking at the feedback. Then I spoke to a couple of schools in my own division where the sport's gone in place and the feedback's really positive. The concern, so overall, is the coverage of that work in terms of looking at which obviously we'll get to the breakdown district and also the issues about Bassetlaw, but also reading through the report. So my concern is the schools aren't engaging, because my experience has always been the schools that are engaged are probably the ones who are the ones who sort of reach the converted a bit more into the support they're willing to engage, but the ones who aren't are where we might be having more issues where actually we could do with getting into. So I know you've talked about going to governors, for example, to start to spread the message if the senior leadership team perhaps aren't engaging. Is there any difference between maintained schools and trust schools in that sense of engagement? And also, what would be potentially next steps in terms of if it's still not getting through after governors? In my head, it's going to directly to parents so they're aware, because my concern is perhaps they're not even aware this exists, and if they're not one of the millions watch us on YouTube today, or seen the articles or being communicated by their schools.
I think that it's really important to recognise that for schools this is still a voluntary thing. Okay, some schools absolutely love us and they just welcome us with open arms, and one that stands out particularly is Ashfield Comp. It's an amazing school, and it's a big school as well, about 2,000 pupils. It's fantastic. Equally, some of the academies are less welcoming, and I think there is still that thing around schools that we have no problems here. We don't kind of need this. I think as we've developed, though, the word of mouth is kind of probably more powerful than us trying to sell ourselves. I think the word is out there. No, actually, this is a good thing. This really helps, and it's not just about children. It's about the whole school approach, as mentioned. So I think, even though we've probably been operational for 3-4 years now properly, that is spreading. And I think initially we had the schools that we worked in were given to us. This is what we have to work with. Some engaged, some didn't. As time's gone by, we've let some of the ones go that didn't want us. And then with the waiting list that we've been held, because people are like chomping at the bit, we really want to get in. Of course, the coverage is an issue, okay, and we'll probably get back onto that in a bit, because we have got health inequalities to consider here as well. Some schools have it, some schools don't. It is my belief that it should be in all schools, and I think if parents really universally understood the impact of this, and everybody understood the impact of this, then I think it would be something that people would welcome with open arms. Still, nevertheless, health and education is a separate system. However, what we know is true, that once we've got in there and established those relationships, those barriers do dissolve, and we do work together as one.
Thank you. And I think picking up on your point, Carl, about it's a health service going into a school, I think that's where the relationship with our education psychology leads and other colleagues in education who have those trusted relationships really important in terms of helping share the benefits of a mental health support team working with us to do some of that myth busting, and I think that's been really valuable. So I think where we have had challenges, we have kind of escalated to them and would continue to look to do so, though what Carl said, but now that word's out there, lots of people are very keen and on the kind of waiting list and wanting that support, but some schools have some of their own support, and I think that equally why we need to take time to understand what is maybe available in schools and where mental health support teams can yield the biggest impact.
Sorry, can I just add about the education psychologists? Absolutely critical. They've really opened doors for us and are really helpful. So yes, I think partnership working, it kind of replicates what we do with children and young people. Actually, that partnership working with wider professional network is absolutely key. Thank you.
Yeah, thank you. And just before I go out to the committee, so it's looking at the issue around the funding. Obviously, with NHS not being invited to fund because in there probably because we look too good compared to some other areas who perhaps haven't done the work you've done there. Which, I mean, I have my own thoughts on the competitive process around that. However, just about there many of the committee's comments when you come back on your other items is would a letter from ourselves to NHS England to reinforce our potential desire for more funding to come in based on the success of that programme there be, do you think, welcomed and helpful towards that? Because I think especially the one we can really talk about is the Bassett Law in terms of a prime example, I'm sure, which I know colleagues will get onto, but also the fact of the equality, the health inequalities of a certain parts there. So I'd obviously appreciate the committee's input into that before we get to that at the front end for recommendations to move. But just looking at Nottingham, I'm sure that won't be round once. That's always good to start with. So thanks for that. So I'll go around the room. I've got a long list already. So Councillor Anderson, and it'll be Councillor Martin after that.
Thank you, Chairman. Looking at page 19, table 2, the table titled percentage of schools that will be covered by mental health by 2025. With the level descriptors underneath, those 5 criteria of deprivation, children for eligible free school meals, I won't read them all out. I'd just like to know why Ashford and Mansfield seem to have a relatively lower percentage of schools that are supported by this, bearing in mind they will probably be top of the criteria of those. Thank you.
Thank you. So, in terms of the school coverage, in the presentation, I covered that NHS England predetermined the initial schools, the initial areas, and we worked with education colleagues to plan the families of schools which would take part in the Trailblazer. Since we have been able to locally, between Notts Healthcare Trust, Integrated Care Board, Public Health and Education, planned schools, we have used those indicators in terms of the schools within a district. We have worked to test coverage in every district to so that we're gathering lots of intelligence about what are the needs of mental health support teams, where do they need to operate, do they need to operate differently to meet the needs of different populations. But we are absolutely committed in terms of additional rollouts, focusing them on in Bassett Law, Mansfield and Ashfield. We would be led by the deprivation data and focus there. But within each district, we have used these factors within that district to plan the schools, and it has also been influenced by, as Carl stated, whether an area is interested in having a school, whether they're ready, competing priorities. But these have formed part of that picture. But we are keen to work with those areas which do have the highest levels of deprivation in further rollouts.
I'd just like to add that the number of schools, the way in which each wave is that each wave is supposed to reach out to a population of 8,000 children. Okay, so within Mansfield and Ashfield, we do have the Ashfield Comp, and that's just one school, and that covers 2,000 children. Equally, you could have a small primary somewhere that may have 150 children. So the number of schools isn't necessarily representative of what we do. It is that overall coverage. So each wave, each team, it has a scope of 8,000 children.
Sorry, just come before I go to David, just on that one. I get what you're saying absolutely about percentage schools as supporters. I think what might be helpful is, after the meeting, to look at the amount of pupils that are actually as a percentage, because like you say, it isn't representative if you've got a large school compared to the smaller ones. That's a bit more accurate, so we can actually make sure they go across. Because like I say, when you look at it and see that number of schools in the locality, there is a difference of Ashfield 49 to Waxford 43, which will be on geography, like I say, and school need obviously. But I think that would be much more helpful, so we can make sure those full facts are out there on that one. So thank you, Councillor Martin.
Sorry, yeah, thank you, Chair. Yeah, I should just probably declare that my daughter is a reception class teacher in Ashfield, actually. So I think it might be helpful, Catherine, if you could explain at some point about where the funding comes from, because I don't know whether it comes entirely from NHS funding or whether it comes from the public health grant as well, or whether there are other things. And of course, the other thing about it is this service has only been running about 3 or 4 years, which people probably in this committee might not realise. So it was set up in 2021 and it's been growing since then. And in actual fact, it relies on people engaging with it from those schools and trusts. And I'm glad you're at Ashfield, because that's the 2 counties trust. They've got 7 across the district. And of course, you supported in that with the Not Alone programme, which was quite good. But obviously, a lot of people, some feedback I've had about the Not Alone stuff is, yeah, we apply for all the stuff and then we don't get the help. And I said, well, it's probably down to money, because you can't help everybody. And that's the other thing. It's obvious, Carl, that you're very passionate about what you do, and I love to hear that. And I do think it's a very important service, and it deals with the fragility of our youth across the county, which is a huge task. And it's all about engagement and reciprocation from the schools and the education. And believe me, it's very difficult to engage with some of these headmasters. If they're not switched on to something, if it's not within their school hours, they're not going to do it. And that's the kind of thing that you're up against. And it's until it gets on their radar and they get probably one pupil in there that really highlights that maybe we need this to help us. I do think your student voice, those write-ups that you've got from you, they're very important, because they show where you've actually made an impact and the effect, the profound. We're not talking about a small effect. It's a profound effect on certain children who sometimes come from very, very awkward and poverty-stricken backgrounds, and it's a lifeline for some of these kids. And perhaps, I don't know how we could do it, but engagement with parents, if we could involve them, and if we could make the Not Alone more social media friendly and interactive, I think we might get more engagement from parents who sometimes are oblivious to the blight of their children until it's too late, and that's the real sad thing. So the other question now. So my 2 main questions is if you could explain about where your core funding comes from, and also your ability to retain and employ staff, because that's another real serious issue. And I think before people actually level any criticism at you, the funding is key, because obviously that inhibits your ability to help people. So thanks for all you do. Thank you.
Thank you. I'm going to answer the first part of the question. So in terms of the finance, Public Health fund a whole school approach lead. So that's a full-time person who works within the Tackling Emerging Threats team, and they work to ensure that across all Nottinghamshire schools we have a consistent approach to children and young people's mental health. So where there aren't mental health support teams in an area, that person is linking with those schools to assist them with resources, and has a close working relationship with Carl and the mental health support teams. In terms of the rest of the significant investment, that originally came from NHS England through a competitive bid, and then has been passed through to the Integrated Care Board, where we are now currently funding those mental health support teams. Currently, the opportunity to bid for additional mental health support teams would be to NHS England, and as I said earlier, we weren't invited to bid as a local system last time, though we expressed our wish to. So we are waiting for kind of national planning guidance on when there might be future opportunities to bid, and in the meantime looking at how we can work across other services to provide improvements for younger people as they wait. Anything to add?
Yeah, if I could just add to that, in terms of that recurrent funding, that's absolutely there. We are waiting to see if we can get additional funding for NHS England, given all of the priorities that we've got around mental health locally. If that's not going to be forthcoming, we will be looking at how we prioritise that expansion of mental health support teams alongside all of our other mental health priorities. And I think we've made significant progress across Nottingham and Nottinghamshire compared to a lot of other areas, and it's certainly something that we as an ICB would want to see that expansion continued. Working as sort of a whole mental health offer for our children, so the first point of call isn't into CAMS or it isn't somewhere else, that we can get to those children as early as possible, really. So I think we just need to understand what that financial landscape's looking like and then work through how we're going to sort of deliver this going forward.
Thank you, Councillor Martin, for your acknowledgement. Recruitment and retention is a big issue. That's our job. And yes, everything comes down to resource, but the mental health support teams do represent a real opportunity for staff. So our educational mental health support practitioners, they start up as a band 4 training, so that's a year's university training. So you do get a degree at the end of this, which in many ways is kind of like a starter into a career pathway. And what we found initially, and we fed this back nationally, is that people were getting that qualification and then thinking, oh right, okay, that can springboard me into something else. That created a bit of a problem because there isn't a stock of those band 5 practitioners in the country. So if people left, then it was hard to re-recruit. Plus, when things were first done in COVID, we had to accept people from all over the country because a lot of the training was online. So when COVID ended, what some staff did was they just went back to their original area. However, things have settled, and yes, we still continue to have turnover there, but we've innovated by developing roles. So the senior EMHP, which will be a band 6, that's the next level up, to try and support that. And our most recent initiative is actually having assistant roles at band 3, so we can encourage people with lesser qualifications and lesser aspirations in terms of career. So kind of like growing our own, because we recognise that this is a national problem, and I certainly go to lots of national meetings where everybody's scratching their heads, how can we keep these people? But yes, that's certainly something that we are doing. And you're right to recognise that we are passionate within Nottinghamshire. And I just wanted to come back to what you said, Councillor Wheeler, about if there's any help that anybody can give us, we'll grab it with both hands. So I know that in many ways we are now filling out a little bit. So if you look at Newark and Sherwood, for example, with the new wave that will be operational next year, we'll be up to 87% in that area. I want 100% everywhere, okay? Because what we have is health inequalities by having an MHST in a school in one district, but then further down the line, it's in the next town or whatever, or in the next village, there isn't that there. Plus, also, it's about making sure that there's a pathway, so that the MHST provision is there for primary schools, which then feed into the comprehensive schools. And at the moment, because we're kind of in that in-between place of trying to fill everything out, there are those inequalities which do bother us. And we do recognise that that is a challenge for teachers, for schools, but most of all for children and young people, because they don't understand funding, they don't understand why it's there and why it isn't there. But I guess it's incumbent upon anybody who can influence and support to help us with that. I hope that answers your question. Yeah, thank you.
Okay, thank you. So next, Councillor Warm-up and Councillor Carr after that.
Thank you, Chair. Can I say first of all that all the work you do is very commendable, especially with the resources that you have at this present time. But I've got a number of questions that must be asked. For Nottinghamshire not being invited to bid in the last round, I find it absolutely astonishing for more MHST resources, because less than, just a little more than 30%, less than 45% of people at the present time are under or covered by the MHSTs, and it just seems very, very sad that Nottinghamshire wasn't allowed to even bid in with so many children not getting the opportunity at the moment. That was absolutely astonishing. It's said in the report over half of mental health conditions start and are established at the age of 14. And so it is essential that early intervention schemes are established as early as it can possibly be, and prevent problems from escalating into later life. My first question is, it seems only 35% of children, that's around 3 million, get help from mental health teams. So that leaves approximately 6 million children that are not being checked for diagnosable mental health problems at present. This means that many of those not diagnosed go on to want specialist support in later life, and this could impact on their lives badly. Is this acceptable, and what is going to be done about it? That's an absolute question. Is it not true that early intervention is one of the answers to the problems? And you're saying that I say 30% of schools are actually getting MHSTs in at the present time. In the schools that aren't getting this, this help, are teachers getting any information on mental health issues so that they can establish what to look for the incidents in their schools, because that must be absolutely essential. You say that children and young people should have access all the year round to the service, not just at term times. But if only a third are getting the appropriate help at present, how are you going to increase the support all the year round? That's not possible, is it? My next question is, why is Ashfield and Mansfield, looking at page 18, table 1, why has Mansfield and Ashfield only got one MHST when every other district and everywhere else has got one each? I just wondered why that was. It seems a real anomaly, that does, especially with all the deprivation in those areas. Incredible. Can I say that Mansfield and Ashfield share serious health inequalities, as you're aware of that, and compared to other parts of the county? Is this a resource issue? Do you agree with me that support should be maximised where it is needed most? Now, let's have a look at table 2. There's always a number of spoke about it. And again, I'm astonished that Bassetlaw, Mansfield and Ashfield again seem to be the poor relations of schools supported by mental health support teams. I mean, you look at Bassetlaw, 12% of the schools supported by MHSTs. Mansfield, 29%. Ashfield, 24%. Newark and Sherwood, 87%. That's incredible.
Yeah, Councillor Moore, I completely agree. Well, obviously, we have covered some of those points there. So after the end of this, I'll let the officers come back to you, and then we can sum up the.
So I'll let you answer some of those questions. I've got many more, I'm afraid.
What's coming first?
Thank you. So when we asked why Nottinghamshire wasn't able to bid this time, we were told it was because some other areas had currently lower coverage than us, so NHS England was working with those areas so that they were able to establish teams. We're all really ambitious that we have the maximum coverage available that we can possibly have, obviously, but I suppose NHS England are trying to look at equity across England, but we remain committed to, if we can secure any other opportunities to bid for additional mental health support teams. We think it's really important and really needed. There is other provision I think we have spoken about today. So within those schools that don't have access to mental health support teams currently, the teams will be supported by the whole school approach lead, the tackling emergent threats team, and will be able to have access to all the other resource and provision available by Not Alone, including other services that work within the local area. We would like to have mental health support teams for them as well, though. I think we've two teams operate in Mansfield and Ashfield, but again, we would want more, and I think we've talked about maybe amending the coverage so that it's got in real terms the pupils supported. Or anything else?
Thank you. Yes, I do agree, and thank you for your acknowledgement. And also, I do agree that we are we're not a completed project yet. Okay, and it frustrates me that we don't have the coverage that I would hope, and we would all hope to be 100%. There are two teams in Mansfield and Ashfield, and in terms of Newark and Sherwood, which states 87%, actually that includes a team that is not, we're just developing a team. So this is what happens. If we get more waves, we can have more teams in areas, and that will fill towards 100%. What was the other part of the question? We covered it. Yeah. Okay. Thank you.
I'll come back to you at the end. Okay. Yeah. Okay. Thank you. So it's Councillor Welsh and then Councillor Clark. Sorry, Councillor Clark and Councillor Michelle off first.
Thank you for coming today, and thank you for giving that report. It's probably one of the most important issues facing children and young people at the moment, specifically post-pandemic, and what's going on in the rest of the country at the moment. So first of all, I always get really disappointed when I hear about funding having to be competitive. If there's a need there, then there should be that drive to get that funding, and I'm really disappointed that you're good with you're being treated the way you are because you're doing such good work. And I find that's really, really disappointing, and I think that's a disservice to the children and young people in Nottinghamshire, because there is an obvious need across the whole of Nottinghamshire. I was slightly surprised when you said about the engagement issues, and there was a bit of talk about head teachers not engagement. That's not my own personal experience when I go into schools across Nottinghamshire with regards to mental health support. They're crying out for it, particularly in our primary schools. The level of teachers and head teachers that say there's more mental health issues in their primary. These are head teachers, been head teachers for 40 years. And they're saying, the mental health in our primary schools, we've never seen anything like this before. Never seen anything like it. Even, eating disorders, from a very, very young age that we've never ever seen before. And I think we could have an endless discussion about why that might be the case and where those influences are. But I would be interested to know a bit of a deep dive with regards to what schools can engage. And I think it's really important for either us as a committee, but at least we've got the chair here of children and young peoples, and to know what schools are engaging currently and what schools you are covering. Because the other thing is, if we talk about Newark and Sherwood with 87%, or even in Gedling, actually, I could pick out schools in Gedling where I think the need would be higher because of levels of deprivation. You might not be in those schools, you might be in other schools. I will say that I think sometimes it doesn't matter what background you come from, mental health affects everybody. So I think we need to know which schools they are and where they are. I also think that the table on page 19, as much as it's there to be helpful, isn't helpful. And the reason it's not helpful is because you're telling us the percentage of schools covered by MHSTs by January 2025. I would like to know what the situation is now, which is why I asked for this report to come, because I've been visiting schools, and my experience from visiting schools, and this may be anecdotal, is that it's patchy. Some people have got it and some people haven't got anything at all. So at the moment, by January 2025, what we're saying is 190 schools by January 2025 will not have the MHST provision. That's a lot of children. A lot of children. And that's why I think it's even more frustrating and wrong that you weren't allowed to compete for that funding. But 190 schools, so for me, it's what schools, how many children are you actually supporting in each of those schools at the moment? I think that's really important. And then I want to look at, and I've said this again, I feel quite passionately about health inequalities. People in the county, this country, county live 7.5 years longer than those in the north of the county. This is not reflected here in these figures. So in these figures, if we turn these percentages into numbers, okay, and again, I'm not saying that these areas that have got lots of provision shouldn't have the provision. What I'm saying is it doesn't link with those things that are underneath at all, because in Ashfield, if I did the maths right, it's 11.77. So 12 schools in Ashfield by January 2025 will have MHST provision. Newark will have 45. Rushcliffe will have 22. Boxtel has 22. Gedling has 21. And Mansfield will have 14. So on paper, our most deprived areas in Nottinghamshire have got, in Ashfield's case, has got less than half of what they have in Newark and Sherwood and in Rushcliffe, who have pockets of deprivation. There's no denying that, particularly in Newark and Sherwood, but they are not our most deprived areas. That concerns me, because you're telling me this isn't the data now. This is the data in 10.5 months' time, by January 2025. So how many schools at the moment are in Ashfield and Mansfield, and how many are in the more affluent areas? Because deprivation data, number of children and young people eligible for free school meals, well, I am telling you now, Mansfield and Ashfield are way above those other areas that have double the amount of schools with the support. So if you're telling me there's more need in those areas, in Gedling and Rushcliffe, then that's fine. But then don't tell me that you're going on this data of level of deprivation, because that is certainly not reflected in what is before me now, and won't be reflected in January 2025, which is 10.5 months' time. You know, so that is a big, big concern for me. The other thing I think is really important that was brought up today, and I'll make this my last point, is the fact that there is different schools deliver different kinds of mental health support. And when I used to work directly in schools and visit other schools, you used to see that in 2014-15. Some were really good at it, some of them were okay at it, and some of them would pass it straight on to CAMHS. I think there needs to be an overview or a review of what is actually happening for our young people in our schools. And one of the reasons that I say this, and I don't know whether you're aware of this, but in Ollerton, in the past 18 months, 7 young men have committed suicide. It is the highest rate in the whole of this country, and has triggered something down in national government. They are young men, you know. That is it's the highest rate in the country in the last, you know. So I want to know where it's happening, where is this support happening, how is it happening, and how is it delivered in schools. Now, that's not just going to be you that's going to have to do that, but I think as a county council, we need to have a real good review, because my worry here is some of our most, and this isn't your fault, this isn't criticism, this is about processes and what is going on already. What these figures are suggesting here in our most deprived areas, kids aren't getting that support that they need. That's a massive worry in our most deprived areas. So we need to know, is that partly because some of those schools are already delivering something? Because if it is, great, we don't need to figure it out. But if it isn't, then this county has got a massive problem. And what that problem leads to, sadly, and I can say this from personal experience, who has lost somebody to suicide, and it's horrendous. What that leads to is young men and young women having mental health problems. And what that leads to is the most tragic of circumstances. And if we have got primary school kids in Nottinghamshire with eating disorders, which they are, self-harming, refusing to leave the house because of anxiety, this should be an absolute top priority. And I know it's a top priority for you, because you wouldn't be doing the jobs that you're doing if you didn't feel passionately about it. And I feel like I'm preaching to the converted in a lot of sense. But I really do think there needs to be a whole county review on this, because it cannot, if these figures stick by January 2025, I have serious concerns about the mental health of children in some of our most disadvantaged areas. And I'm putting that out there and saying that publicly, because I really, 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 really do. And as I said, you know, by January 2025, if we still got 190 schools that aren't going to get your support, what are we going to do as a county council with regards to that? Because we need to do something urgently.
Thank you, Councillor Welsh. Yes, you are preaching to the converted, and I do agree, and it is a concern. And yes, of course, I work in CAMS, so I am aware of that lives do get lost, and one life lost is too many. Okay, and yes, that has an impact. So if a child dies in a class, that the whole that class is going to be affected by that. And yes, there are gaps. And what I would say to you is, if you give me the resource, I'll give you a service. Okay. It's kind of like, I feel like nationally they need to dust their wallets off and get their hand in the pocket and get this sorted out, because I've worked in children's services for over 20 years and we talk about early intervention. Okay, this is early intervention in action. This works. Okay, but it's not there everywhere. And it frustrates me, and I haven't got an answer for you. Yes, I mean, in terms of these figures, there is a different way of looking at this, because each wave has to reach out to between 7,000 and 8,000 pupils. So it would be better to have a slightly different table. Okay. Nevertheless, there are some schools where there is need, where we are not able, with the resource that we've got, to go in there. Okay, because we just don't have it. But like I say, and I do get really passionate about this. You give us the money, I'll give you a service.
Can I make a suggestion and then just second what Councillor Wheeler said about, I think, not only just contacting NHS England, I'll happily sign any letter which goes to any government minister with regards to funding for this. Quite happily sign that.
Just wanted to come in just to add, we certainly can provide post-meeting the data broken down in a different way. So we've made a note of everything you've asked for, numbers not percentages, and the actual schools. So certainly we'll send that post-meeting, so it sort of makes sense around that coverage.
Can I just add as well, year before last we had a minister come, her name was Ford, I'm sorry I don't remember her first name, I think she still may be in government as well, came to Ashfield, and they were very, very impressed, and Gillian Keegan came to CAMS as well last year, so people, they do know about it, but I think that further than just kind of rocking up and having the photo opportunities and stuff, what I really want, I'm sorry if I'm speaking out of turn here, but we want action. We need what we need. Thank you.
Okay, thanks, Councillor. I'll come back to points at the end around the letter there, so to go in more detail. Councillor Carr.
Thank you, Joe. I think perhaps what would be useful is an amendment to the table on page 19, which shows both the percentage of schools and the percentage of pupils. So, and that's easily done because every school publishes its roll. I think we could see the full picture then, couldn't we? I think that's the. And whilst I do agree that we should be sending a letter about funding, but funding isn't the only thing, is it? It's attitude, and I'm afraid that we have created an education system which is so fragmented between different schools and how those schools are governed that it is sometimes very, very difficult to get beyond that and have a consistent approach. We've now got the situation where when academies came in, the idea was that there would be a standalone academy where the head teacher would have not virtual but a lot of autonomy on what happened within that school, albeit the curriculum is the same everywhere. We've now got groupings of academies which are like mini LEAs, and there doesn't seem to be much control about their extracurricular activities and what they should be doing. And this isn't all academies, I agree. I'm sure that you've got academies on your books, but I know from none of the ones in my division, but from other ones in Broxtowe, that there is a reluctance to engage with this sort of, and it's awful to say it, but they view it as extracurricular activity, and it's vital activity. I mean, I'm part of the Broxtowe Crime Reduction Partnership, and we really struggle to get some of the academies to accept the help that we're offering with regards to reducing knife crime. I mean, it just does not make sense at all. I mean, it is hugely important. So perhaps one of the things we should be putting in this letter is that the role of the regional inspector that looks after and is meant to control academies and doesn't, should actually revert to the local education authorities, i.e. Nottinghamshire, Derbyshire, Leicestershire, whoever, the city of Nottingham. But that's up for debate. And of course, the other thing is that it is really important to get people when they're young. I'll use a personal example, but wouldn't want it quoted. My son will be 30 in May, and when he was at school, he was highly intelligent, but at the same time disruptive, and at the same time he could cause the teachers a lot of problems. And it was one particular teacher that recognised that, yes, whilst he can be disruptive in lessons, he wasn't all the time, but sometimes he was highly intelligent. And she sort of gave him things to do extra to the other children that curbed that. But that's all that happened. He went through senior school. It appeared now and then, but wasn't a substantial problem. It only really materialised as a mental health problem when he was at university. And my goodness me, you get no help at most universities, and that's been highlighted recently by a case that's been all over the news. You get no help when you're at university. But he's turned the corner. He's now, he got a first. He's got 2 MScs and he's now in Canada doing a PhD. So thanks to that teacher in his 3rd year at junior school who noticed there was an issue, and he has been diagnosed with ADHD, but it's taken until the age of 28 before it was diagnosed, which is why it's important to get people early. The other thing that I would mention is and I've completely lost my train of thought. I think I'll leave it at there. I would support a letter about funding, but it's more than just funding. As on most things, to be honest with you, can throw money at something, but if there's an underlying problem, throwing money at it won't solve the problem.
No, can I start before coming in? I completely agree about, money isn't the only solution. I say when you look at some of the actions there, and I'll get to at the end in terms of the work that's been done with peer-to-peer in terms of teachers they've been on the training and the cross-trust as well. You've got some trust, most trusts are going across the borders of Nottinghamshire into the areas, and so there's a lot of work they can do themselves as well, not just relying on that extra funding support in place. But obviously we'll get to that at the end. So anything more to add?
I was just going to add quickly that there is a piece of work, so as part of community mental health transformation and long-term plan objectives that we're working on in Notts Healthcare, we are doing a piece of work with Nottingham Trent and Nottingham University wellbeing teams. So I'm not going to go into depth because that's not what this is about today, but I just wanted to reassure you that there is a piece of work happening.
To be fair, Nottingham are actually one of the universities who are very reasonable. It was the university he went to after.
But we're working on pathways between their wellbeing teams and our services. So just wanted to mention that that's happening.
Okay, we'll call it that one, don't worry. We'll put that in the minutes, don't worry, Councillor Scott. So that was Councillor Adams, followed by Councillor Turner.
I've absolutely no idea I'm going to follow that exit. Okay, just on these points, I just want to say, first of all, that thank you for the presentation, all of you. I thought it was very good and very in depth and interesting as well. It's great to see it becoming more commonplace, and long may it continue and grow and become a fundamental part of the whole of the education system across Nottinghamshire. I think I want to just dive in on the point of what Councillor Welsh said around the outcomes, if you like, and they're the things that we hear about in the news, whether that be the suicide or whether that be part of an eating disorder, whatever that be, because we know that's an outcome of attempting to control an uncontrollable situation as the person perceives it. And I want to understand how you deal with that in schools, because there's a few things around, especially in the press. Obviously, we get a lot of alarmism out there. Things like, obviously, with regards to COVID. I mean, we all went through that. And we all know that there was a lot of alarmism around at the time, and specifically as well, you had things like climate change into it as well. And I've heard some stories where children have taken their lives over that and over climate change. And I suppose what I understand is how do you manage that alarmism within the classroom environment? So how do I just wonder how that works. You talked about teachers being involved in the process as an overall. How do those teachers ensure that although that alarmism is out there and that concern is out there, that's managed into palatable parts? Because you did make a point around children focusing on the wider world and realising that they can't solve all of the world's problems, but they do take that responsibility on themselves, because they're told all the time that they're the future, and they're going to have to take on this responsibility, and this is going to happen in their lifetime. And I wonder how you manage that. I also wonder around the peer mentoring scheme as well that you mentioned, and ensuring that the onus isn't on the child in terms of responsibility if something happens to the person that they're mentoring. How do you manage that as well? And if somebody hasn't got something wrong, if you like, or something that they're dealing with, how do you avoid placing that thought almost within that child's mind that they maybe should feel that something's wrong? Because we're talking about it, and if we're talking about it, well, why haven't I got it? And do they then find that as a thing with them? And my final point is, sorry to quite a few there, I know, but it's the process of ensuring as well that as a result, these children aren't becoming silos in terms of their connection with their parents. How do you ensure that the parents understand the challenges that the child's facing, and particularly that communication between yourselves as a service and the child themselves? And that about wraps it up. Thank you.
Thank you, Councillor Adams. I might come back. So I've got all of your points. So managing, anxiety is very much part of being a human being, and that kind of normal development. And I'm sure that's something, no matter how young or old we are in this room, we've all been a child at some point, and school can be a wonderful and a very unwonderful thing as well. And certainly some of the things that you were recounting, Councillor Carr, I can certainly identify with. In terms of how we manage this, I guess it's about being really proactive, about having open conversations. There's no such thing as a daft question or a daft worry. One person's worry might not be another person's worry. So I guess it's looking at it in an individual basis. And this is why the whole school approach works particularly well. So individually, that's great, but that's a little bubble. But when you look at a whole school population and you have these conversations and people say, well, I'm really worried about that, but I'm not really worried about that. And this is where the peer mentoring scheme really works, because it gets kids talking to other kids about how they feel and how things are. And of course, yes, that's managed. So we have our education mental health practitioners and our senior practitioners, our CBT therapists. So we're there as an overview and as like a safety net, but we want to let them get on with it. But we also want to make sure that they don't stray too far off the path, so they can keep focused on outcomes. Sorry, what was the other question?
Not presenting with mental health.
Oh yeah, so people who are not presenting with mental health, I think it's really important to normalise real life, and just because you may be concerned about something that you've seen on the news, for example, I know that what's happening in the Middle East has been a big worry for a lot of kids. Is there going to be a war? What does that mean? People are dying, and all things that come to us. And of course, maybe some of the things where we're continuing to do research and supporting with our educational psychologists and broader research is around the impact of social media. I think particularly for these generations. I grew up in a world where there were red telephone boxes. There was no mobile phone or computers, whereas now, what do we really know? So I guess we need that feedback from them about what they think, so we can support them with it. But I guess that feedback loop it runs all the way round, and it runs right the way through MHST. So offering something, getting feedback, what's that like, adjusting, as we do for different schools and different individuals. But again, working with the ed psychs and having that joint approach around teaching for trainers, training for teachers, the other way around, is really, really important, because it's about that consistent approach, okay, so that people aren't singled out or thought that there's something weird about you, because we're all individual. And I think one of the things that I definitely stand for is individuality, which is really, really important. And of course, in a school, you're just like there is a saying, isn't there, about a school of fish. You're just like one little kind of entity in a huge bowl kind of thing. And the parent relationship is absolutely key. So again, I think I said this in the presentation, that we can work with kids one-to-one and in groups, but then when they go home into their other world, it's kind of like, well, how does that relate? So I think the work that we do with parents to educate parents, not to say that they're wrong or they do anything wrong, but what are their concerns? What are they worried about? What do they notice? What is it like when a child comes home? I remember this from my own child, come home from school, in floods of tears. It's like, oh gosh, what's going on? Because at home, everything's okay. But again, with social media, it's all can be very uncontained. So I think that the workshops that we're doing with parents, with and without the children, is really, really helpful. But also that psychoeducation around what's it like to be a parent, and what's it like to be a parent of a teenager, or somebody that's primary school, your developing child. So it's very much a broad partnership approach for everybody together, working together. And it's not just about us going into school and delivering something. It is a whole school approach, which is a psychological movement, which we know is evidence-based, and it is about that partnership. So the way that we check out that it's working is through the feedback loop.
Thank you. Yeah. So what's the vehicle then for communicating with a parent if something like that's happened? How do you approach that? Somebody's come to you and it's something that's gone off, whether it be bullying or whatever it is. How do you then begin that process with a parent in terms of the feedback loop to ensure they're fully informed if that hasn't presented itself at home?
So to establish the therapeutic relationship, we go through the boundaries of confidentiality, because as we said from some of the feedback, for some kids it's really important. Can I trust you? Because I think lots of kids are quite mistrusting of adults because they observe stuff, but what they see is what they see. So I'm new, I'm Carl, I've got a badge, I tell you who I am, but who are you really? So there's something about building that therapeutic relationship, but right from the start, safeguarding and harm and looking after a child is something that is clearly communicated. Okay, so if you're going to tell me something and I'm worried about that, I'm going to tell your parent or your carer, but I'm going to do it in a sensitive way. Okay, and I'm going to do it in a constructive way, and I'd want you to be involved in that. So it could be that we might meet together with your parent, okay, or you might not want that to happen, but you must understand that if I'm concerned about you, that I will do that, because that's about keeping you safe. And of course, for children, I know the law says 16, but really 15 to 16 is a bit of a strange time with transitions and stuff. But the law's the law, so you're still a child until you're 18. So we make that really, really clear to people. Involving parents, again, that's something that needs to be managed very sensitively, because some parents are really engaged, really want to know. Some parents are overbearing, do you know what I mean, and want to be in and control everything. And equally, there are some parents who they're not really that bothered. They're busy getting on with their own lives. So I guess it's around cutting your cloth to suit what's in front of you, really. And it's about being helpful. And this is our premise. We're not there to tell people that you're doing something wrong. We're saying, here's a concern, here's a conversation, and how can we manage that conversation for a better outcome?
Councillor Turner and then Councillor Bailey.
Thank you. Thanks for coming today. Very interesting. Just going back to the chart on page 19 and the MHST scheme and the Take 5 Resilience programme. what sort of collaborative work, if any, is there between the two programmes? Because there's 44 schools in the north of the county that are covered by the Take 5 Resilience Scheme.
Thank you. I think that's. I understand that the Take 5 Resilience Scheme was in place, but I think it has now ended. So I may need to take that away to find some more information. I understood that that was a training offer that was available in schools, in primary schools in Bassetlaw, and they provide mindfulness training as well, but that is no longer provided. Though the schools will obviously have everything that they'd have learned through that training. So I don't think that the programme is available. So in terms of the mental health support team offer in Bassetlaw, that's focused on the secondary schools.
Just to add that we are in 7 schools in Bassetlaw, but they are all the secondary schools.
Yeah.
And yes, I absolutely agree. I would really love us to have all those feeders as well into that. I remember the population does move each year by 15 to 20% of kids leaving and kids joining and stuff. We do have close relationship with other partners in Bassetlaw. Some of the GP surgeries are very proactive in terms of creating stuff, and actually Bassetlaw, in terms of its communication and its comms, just broadly to the population, I think is very supportive because it is quite a rural area. Yeah, I don't know if that answers your question, but we're doing all that we can to try and support the growth. And it is difficult when you're working in an area where something else is going on, because we don't want to tread on people's toes and we don't want to confuse people either. But it is my understanding that the Take 5 thing has come to a conclusion now, but Catherine will confirm that. But yes, we certainly would like to see more. But again, there are other concerns within Bassetlaw which are very proactive.
Thank you. Can we keep that on put that on the workflow? Yeah. Thank you.
Absolutely. Thank you. Councillor Bailey.
Thank you very much. So I'm a Bassetlaw council alongside Nigel. So I'm going to comment on the Bassetlaw stuff first, then I'm going to go to probably our Essex one first, actually. In terms of the demographics of those currently within the team, I know it's a significant number of female, whilst I think male is 35 or 38%, just off the top of my head. I suppose my question is, in terms of concern for male students, what actions are you taking to make sure that male students are also receiving the assistance, particularly considering suicide rates for males? Obviously, we don't want anyone left behind, so I'll just pick up on that one. In terms of the Bassetlaw then, I know we've spoken about how, I believe you mentioned that all 7 schools in Bassetlaw are receiving these teams. I'm not sure what that is a percentage, but my understanding was that 6 schools would have received it based on the stats you provided for the percentage of schools. But if it's 7, then I'll go with that one for yourselves. And I know you said that obviously when you went to apply for some support for Bassetlaw schools, eventually you said because of the coverage in everywhere else in the county, you wouldn't be eligible to bid. My question is, when were you aware that the current support for the primary schools in Bassetlaw were going to run out? And were you making any plans in advance of that for them to receive these teams? And when you were making the decisions, when did you actually end up finding out the criteria for these bids? Because my only concern is, when were you aware that primary schools in Bassetlaw were going to miss out? That's my main concern, because obviously if you knew that the support was not going to be there permanently and you were ready to bid, where were the proactive nature and when was the transition going to be made, essentially? And I suppose the other point as well, in terms of deprivation, obviously Bassetlaw's very deprived in that sense, as is Mansfield and Ashfield. To be honest, I'm not completely convinced you addressed Councillor Welsh's concerns regarding the criteria and how that was reflected in Ashfield, Mansfield, and compared to other areas. Again, similar to the criteria, I'm not sure that was completely followed in that sense, because I don't think you could ever tell me that, as 87% of Nottinghamshire, I'm not completely convinced you answered Councillor Welsh's question, but I'll leave it at that and let you answer what I've given you.
So when we have looked at, we worked with public health colleagues and did a health equity audit, which looked at the usage of mental health support from children and young people across Nottinghamshire, and it looked at other districts as well. And what we found is that nationally, you will tend to find a lower level of males accessing support than females. But what we did see within all our service data is that actually, in comparison to other areas, we have a higher rate of males accessing support, which is encouraging. Carl may be able to speak about any specific approaches that are considered around the mental health support teams and encouraging males to access support. I know that some of our other services do targeted sessions and group work for males to try and encourage that access. I don't know if there's anything specific.
Yes, you're right. So, we are aware of the difficulties that between genders in terms of, development and kind of engaging with thoughts, processes, and the difficulties. I think girls and women generally are more kind of open to emotional conversations, whereas lads, still that kind of old kind of working class man kind of attitude around, I'm okay, or just going to have a pub, pint down the pub or go fishing or whatever. So we are very much aware of that, and we do encourage lads groups, and that might be around engaging around sports and stuff. So, we might have a kick around or play table tennis or whatever it is, but it's about using a means to get somebody in to start a conversation. We are quite fortunate to have quite a few male members of staff, because again, within mental health, you're looking at probably between 85 and 90% of staff are female. But I think it is really important to have somebody that looks like you, or talk to you, that you can relate to. So we are specifically doing that. Lads and boys can be difficult to engage, but often what we find is once you get in there, it's a lot easier. So what was the other?
In terms of the resilience programme, what I can offer to do is to take that away, because I think that programme ceased when Bassett Law CCG was the lead commissioner. So I haven't got all of that historic knowledge, but I can work to try and provide that following the meeting. And as we've discussed today, we will reprofile some of the data and information that we've provided today. But as we have outlined in our presentation, in terms of our aspiration in future waves, it would be Mansfield, Ashfield and Bassett Law that we would be prioritising. So when future wave opportunities arise, they will be the teams that we would be working to prioritise provision within.
I'd just like to add, and I wanted to come back to your point that you didn't feel that I had answered Councillor Welsh's point. I think that this is down to resource. Some of the decisions that were made right at the start were not our decisions in terms of which schools we would work with. For Mansfield and Ashfield particularly, say we are in Ashfield Comp, and I think that is a real flagship. It's fantastic. It's a fantastic school, and we work really well there, and it's a big population. So it's one school, but it's around 2,000 pupils. Okay. I don't want to labour the point, but it's like if we had more resource, I would be in every school today. I really would, because I think it's really, really important. I think there was more point. I think I might have covered it. Sorry, I'll stop talking. Thank you.
Okay. I think thanks, so I can come to my council question. I think we just have to be careful about stereotyping about the young boys and girls in schools, because there are some who, like I say, will have that attitude of, but also some who just want that support. And I think what you said at the end of that bit about having male teachers there, that is a really strong point, because I think we all recognise the level of male teachers, especially in primary schools, is much lower than it needs to be, and actually sometimes that does help, because unfortunately there is still sometimes some stigma attached with whether it be boys or girls, or how you define yourself in terms of wanting to speak to someone of your own gender. So we've just got to be a bit careful about stereotyping everyone every school at that point. But sorry, Councillor Welch, did you point of clarification on?
Yeah, just a point of clarification to say that I fundamentally support all resources and have certainly never put my hand up for anything and will never put my hand up for anything that takes mental health support or any support for children and young people out of schools. Just want to make that clear. And the other thing is as well, I think we do need to be careful when we're talking about working class men with regards to going down the pub and stuff, because in some of the areas that I've been to, the mental health, such as Ollerton, is a history of where the communities have been decimated. So I think we just need to be really careful with regards to that as well. Thank you.
I would just kind of say I wasn't trying to be flippant or anything. I think it was just a general point around understanding your community. You know, so we work in a lot of ex-mining communities across Nottinghamshire. And of course, a lot of manufacturing industry has gone over the last 30, 40 years. It's not just mining, you know, Players Rally, you know, Boots. There's the whole landscape of family structures has changed. And I guess what we want to do and what we profess to do is to listen to people to kind of get a sense of how it is now and how it would be helpful. But yes, some kids do come from very traditional family backgrounds, and it's really important to try and listen to individuals and to provide support that is helpful to them and their healthy emotional development.
Sorry, just before I can do we cover your points? Do you want to come back?
Yeah, so I know we mentioned about the CCG moving essentially. My understanding was that happened in 2022, as in like formally took place, although it was in the works for a couple of years before that. So that would have been a very noticeable thing for you to have spotted beforehand. I'm not saying that's the day when you eventually knew about it. I'm just talking in terms of proactiveness. Definitely something to consider in the future. Because as it stands, Basildon Primary School students are not receiving one of these teams, and we're not sure if that's due to misunderstanding on dates or whatever. So I'll just leave it there. Thank you very much, Chairman.
Thank you. So, Councillor McGrath.
Thank you, Chair. First of all, I'd like to thank you for the challenging work you all do on a shoestring, to be honest, and it must be very hard for you. But a couple of questions I've got is one, the schools that we don't get, obviously I won't go into Basildon, don't get this, that's by the by. How do we plan, it isn't by the by, it's serious, but how do we plan on getting into the schools that we're not touching, right? And obviously that's got to be funded, right, without a doubt. And my other concern is that when we've touched on it, juveniles, should we call them, right? Because I've had a couple of incidents where people are juveniles and have gone on to really naughty things, right? And had mental issues from the start, but there was no contact between anybody, and without me being rude, it was brushed under the carpet. So I'd appreciate if we had a plan, right? And the work that you do is fantastic. So surely the letter is a must. Speaking to our MPs is another must, and the government, because we're just losing everything. And I'm sure you must be aware all the time. And do we actually have, you know, the people that we can't get into at schools? For example, I could name schools in our place in Stapleford or anywhere. Do we have that contact, or do we go, which concerns me, do we go into the schools, because bullying is another factor within mental health? Do we go into the schools and say, oh, for example, bring little Johnny or little Julie into the office, which then causes a reaction from, because children are as nosy as us, aren't they? Without me being rude. But they are, because it's something new to them, because at the time they're okay. So is there a plan around that as well? Thank you.
Yes, there are always in every generation a very small cohort of children who are very troubled and yes, can get themselves into a pickle really quickly and things can escalate. So whether you're in an MHST school or not, the educational psychology department are across all schools across the whole patch. Okay, so I think that any school, it's interesting you mentioned bullying, because I think some schools would acknowledge that bullying is very much part of children's development, and some schools might say there's no bullying here, we don't have any problems at this school. Okay, Nevertheless, I think we could all acknowledge that would not be a true thing to really acknowledge, you know what I mean? Because children are children, and you get kids together and certain things will develop and happen. So in terms of the plan, I think one of the things that's a bonus around the mental health support teams is that we are a family of CAMs, of which I've already said I'm a service manager of, but we have specialist services there like our FCAMs, which is forensic CAMs. We also have links with Clayfields, which is a locked local authority home for children with a forensic history and stuff. So those links are there. Okay, we also have a very established inpatient service up to and including PQ, which is psychiatric intensive care unit. So there is a whole pathway there. And yes, kids, the more you escalate, the more you're visible. So you can't. It's not really easy to hide. So some schools may wish to not draw attention to them, and I'm not saying that is the case. But if it was the case, then I think we would find out through the police, through social care, of where we also have those close professional links and stuff. So I think if you are in a pickle, you're going to get found out. Someone's going to notice you at some point, and then there are systems and processes in place to try and take care of you. And yes, it is the case. I mean, I worked with a family probably 10, 15 years ago, and a child murdered his parent, which was an awful thing. And I think one of the things that I really learned from that is that these really bad things that are headlines and stuff, they're incredibly difficult to predict, incredibly difficult and incredibly rare, however shocking headlines that they are. But I do believe that the services across Nottingham City and Nottinghamshire are quite comprehensive in terms of supporting individuals.
And I think just to build on that, in Nottinghamshire County Council, there is the Youth Justice Service. It's got really close working relationships with the Healthcare Trust in terms of what is the support that we can provide to children and young people who are in the Youth Justice Service, considering their speech and language communication needs, how we can intervene early. And the Youth Justice Service does a lot of diversionary activity to try and get in there early, support children and young people. So I think again it comes back to that system working, partnership working, which we always endeavour to do.
Okay, Councillor Reddy.
Thank you. I've got a couple of questions. But firstly, thank you for the presentation, and thank you, Carl, for your passion. I can tell it means an awful lot to you. First question is, you mentioned that you speak to parents. Is there a way for parents to feed into the system as such? And then during school holidays, if there's any issues outside of school holidays, how do you feed into that during the breaks? Secondly, have you had a bigger uptake since COVID, and how has COVID impacted? I know children suffered with more anxiety staying in homes and stuff. And then thirdly, if schools believe they're already doing mental health resilience and they're already doing fab work, how do we break that so that you can get into schools? Because I think the work you're doing is so good. How do we make that more accessible for you guys to get into those schools? And then I think my final question is, how do you think we get 100% coverage? How can we help? And when do you think you'll be able to increase those numbers?
Okay, so in terms of our relationship with parents, that's something that we wouldn't push into, but we are very clear that we make that available. So we advertise, and of course the parent groups. So that would either be through communication through schools or from open events. So if there's an open evening or a parents' evening, we will be there and have our own little stand, so people can come and be curious, or we can kind of share out what we might want. In terms of school holidays, we were talking about this actually this morning. You might find this quite strange, but actually the need for mental health services does tend to drop off during the holidays. Okay, so it's almost like, certainly school holidays, some big summer holiday, it's like referrals just go to nothing. This is in community CAMs as well. It's kind of like a catch-up month, really. But of course, we do have the provision of a crisis team. So if there are any issues, then that is there for people. And we're still there. It's not like we go away, although a lot of the mental health support teams, they do take holidays in school school holidays, as do teachers and stuff like that. COVID, wow, I could talk to you all day about COVID, but yes, it literally completely changed the whole pathway. So, I've worked in CAMS for 15 years, but children's services more than that. You kind of get a sense of how things are. And yes, anxiety is always a big feature in presentations, always has been, always will be. COVID, it was kind of like, because there was nothing for a while because everybody was at home. So, we're kind of like, it's not like we've got nothing to do. It's kind of and then there was a big tidal wave, okay, which has taken us really 2 to 3 years to kind of get a little bit more under control. So we had a big issue with waiting times and all the rest of it, but we did have some investment from the trust and from the ICB to support us with that, which has been great. But yes, now, so it's not just your typical eating disorders of anorexia and bulimia. You now have disordered eating and ARFID, which is, again, is a bit like disordered eating as well. So, but it is something that a child can control, because there isn't many things that children can actually control in their lives. But I can stop doing this thing here, and there's nothing you can do about it, okay? That is an emerging thing. So yes, there's anxiety, OCD. We've seen a big increase in that, excessive washing and worrying to a really dangerous level where people have to be impatient, get an impatient bed and stuff. Emetophobia, so fear of being sick. That social phobia of going out, touching. There's all sorts of stuff, but we are responsive as a system. But I think as a society, it's almost like COVID's gone away. But I can tell you from my current sickness stats that COVID is still very much around. Okay, and kids do worry about it. This whole thing around germs, because we were wearing masks and gloves, and now we're not doing something. And touching things and stuff. It's a real worry for kids. So I think for COVID, yeah, things are calming, but I think the worries and the longer term effects will probably go through our system for the next, 10 years or so. And let's just hope, touch wood, there aren't any more incidents, pandemics and stuff like that. And in terms of 100%, it's just down to money, and it really is, because we've got a roll-up programme. Our trailblazers weren't one of the first in the country. We've been very successful. People have actually approached us. How did you do it? What can we do? How can we be as successful as you? I'm not wanting to just blow our own trumpet, but my team leads are fantastic. They are. But I guess we're really passionate about this, so we want it. So in terms of when it can happen, as soon as possible. I mean, when we spoke to Gillian Keegan and the Ford minister as well, they were kind of like, oh yeah, this will be all business as usual by 2025. Yeah, well, everything's gone quiet. So I don't, they've said stuff to us, but actually it's gone quiet. And what's happening? Because there's been no money this year at all. So we don't know what's happening. And there is a real concern, a real worry there, not for people's jobs, but for our children and young people and their mental health and their development. So I think it's incumbent upon everybody to support us and to support this movement.
I was just going to add about your question around the school holidays, because I know sort of Carl's given some information around how it's structured now, and I know that there has been a trial, hasn't there, of school holiday provision, but it wasn't very well taken up at the time. But it doesn't mean to say that we won't trial it in the future, and we can look at altering that and the way people take the holidays and what's available. But we do typically see that drop in quite a lot of our other children's services during particularly the 6 weeks holiday. So I think, but it's something we are open to sort of looking towards developing in the future.
Just to add as well, we have tried programmes. So I know lots of schools, and particularly Bassett Law is fantastic in terms of their school summer programme, which they advertise very widely. We have joined and would join with these programmes across the whole patch. But again, take up is kind of, it just drops off,
Okay, thank you. Just before bringing Sarah Health Watch, one point I want to go on. So obviously we're going to get onto the funding element of it for nature, but assuming there's no more money for nature, this is assuming, obviously, hope you're wrong up there. Obviously, you are being funded by ICB anyway in terms of at the moment there. So what is the next plan in terms of, with that current funding you've got going on there, in terms of the next waves assuming there's no more funding for NHS England in terms of getting more provision to schools, what's your current action plan?
I think if we haven't got that additional funding, and that's been a real lifesaver about getting to where we've got to, we will have to look at this alongside all of our other mental health priorities for the very limited resource that we have for new investments, which again is very limited at the moment. It is ring fenced for mental health, which is really positive, but there are lots of draws on that money in terms of our priorities. But that would be our plan, that we would look at how we can roll out. Might be a very much longer program of rollout than we would like it to be, but we just need to see where we're going with that national additional funding, and therefore what are the gaps and what can we do to take that forward. But it will remain one of our priorities.
Yes, thank you. So Sarah from Health Watch wants to come in.
Thank you very much. I've been listening intently to everybody's questions, and I think there's been some really helpful suggestions within this. And one of the things I'm interested in is that end point, really, where this work is contained within a couple of strategies, but we've not really heard about that this morning. So the all-age integrated mental health and social care strategy, which ends in 2024, is everyone's different, everyone's equal, and it'd be useful for you to look at that because that mentions this work specifically. So within that, I would say the calls for some type of review would be really interesting, because I think understanding the different issues and the complexity of the issues as to why some schools are taking up this offer, some aren't, the issues of distribution of the resources and how that works. And also, I'd be interested in looking at how you are connecting to the other areas of that are related to this work, particularly the joint strategic needs assessments around domestic abuse, around self-harm, around suicide prevention, which all talk about the types of individuals, and that there are groups that are much more vulnerable to death by suicide, for instance, and how we use that to inform the work that you are doing in order to target appropriately. So I'm interested in what's the next steps around this particular strategy, of which this is a major part of that all-age strategy for children and young people's mental health. I appreciate you just mentioned about the funding from the ICB. I do have concerns about the continuation of that funding with the ICB having its own struggles and challenges financially, and how prevention work is being prioritised within the ICB, particularly around this agenda to ensure children and young people have the right support now so that they don't become a statistic in the future as young adults, as we've heard. Particularly the statistics from Ollerton is just heartbreakingly shocking, and something that we have a whole raft of strategies and programmes and things that have been done. The other thing I don't feel I heard this morning was how this programme integrates with others that are going into schools. So you have domestic violence support charity equation that goes into schools working with young people around domestic abuse. And I think those things are all linked, and how, again, when we're talking about resources, do we ensure that we're not funneling everything in one direction where we could actually work smarter, and actually have a way of working in partnership with other agencies that have their own funding to go in, but could work collectively, more importantly, together. So I'm just interested in how you work in partnership, the continuation of funding, always an issue, and the next steps for everyone's different, everyone's equal. Thank you.
So in terms of the finances, absolutely get your point, and that was why I mentioned that in terms of mental health funding, that is absolutely ring fenced. In terms of all the work around the financial position of the NHS, the additional investment in mental health was one of the exclusions around making financial savings, etc. So at this point in time, we're confident that we're able to invest in the things that we need to invest in within the envelope that we have. So I think that's a real positive step on that one. In terms of the strategy, equally we've been talking about the fact that all age strategy ends in 2024. Mental health services, all age mental health services are part of the ICS strategy, so it's integral in that. It's integral in the NHS Joint Forward Plan. And we're really clear that these strategies don't all sit in isolation, they're all part of that whole. So we're looking at that refresh around the all age mental health strategy, and it will bring in those strands from all of those other elements. It's just timing of things of when those have to be done. So we are absolutely aware and of the need to refresh that strategy. What I would say is probably the themes will be very, very similar to what are currently in the strategy. Partly because all of that work, it never concludes, it's an ongoing thing and ongoing priorities, but equally since that strategy was written, we have seen huge change with things like COVID, and we need to rethink what our priorities are going forwards on that.
So can I just ask if that work started, because it's 2024 now, so it's only about to. Okay.
One of the things that we do have in Nottinghamshire is the Strategic Partnership Group for Children and Young People's Emotional Health and Wellbeing. So that's chaired by our public health consultant in the county, with a deputy co-chair in the city, and that does include general practice, health services, education colleagues, social care colleagues, elected members, and that strategic partnership group now meets 6 times a year. It's the owning group of the 2 joint strategic needs assessment. So its work is to kind of make sure that the delivery in terms of that strategy is coordinated and reflected locally. And I think one of the things that we tried to capture in the presentation and in the report is that close, work with key system partners. There's always more that we can do, and we should always challenge ourselves to absolutely do more. But I think we've got some good foundations to continue to build on in terms of how we can do that and make sure we've got that really joined up holistic approach. And that's why that work with kind of our education colleagues is so integral to helping us join up our messages.
Can I ask a quick one coming for us?
Sort of been lost in the ether now, but you mentioned about the low take up of the service during school holidays. You have people here as county councillors that have access to large, probably social media groups. If we know about this and you tell us that this is happening, we can actually tell our communities that this is there. I mean, I have access to just over 20,000 people on social media in South Broxtowe alone. So I think perhaps we should add that to the recommendations that councillors are advised of the holiday service that the team can present, so that we can publicise it to our residents.
Absolutely, because we'll put that down in action points. We can just work out the logistics, see what can be communicated, so we're not duplicating what's already going out. So absolutely, let's get that looked into and come back. So, okay, so thank you. I mean, obviously it's been a long morning, but I think actually, everyone's contributing. It's been fantastic to go into such depth on what is really important items. So I just want to go across the key themes to sum up before we go to recommendations. I think we talked about funding a lot, and it's clear enough. So no one said otherwise, so I will be adding to recommendation about sending a letter to NHS England. However, obviously, as already been said as well, there is ring-fenced funding there, and I think it's just about how that funding is spent going forward, because, as Councillor Carr said, it's not just about the money, it's how we're spending that effectively. And go on to the point around getting certain schools. I mean, we've talked about Bassett Law. To me, I think we've just assumed that Take 5 programme is doing what we think it's going to do the same as what we've done elsewhere, which, I mean, I've not seen anything said to me about the quality of that Take 5, if it's the same level as what you've done in the other piece of work. So that's my concern. Has Bassett the same level of service that we've done to elsewhere in the county? And I think obviously, and as Councillor Bailey and Councillor Taylor commented as well, the fact is that's stopped now, and I said that there. It's about what we can do in the current funding envelope, current resources to be working with those schools, make sure they don't feel like they've just been abandoned as part of that being left, because that is also a concern as well. Because again, there's primary children, as you know, going to go to secondary school and obviously going for that same programme as well, where you're currently into it, so we need to, as we can, get there early. So if we can take that way to look at, I think that would be really important to make sure we cover up, to cover over, sorry. And I mean, in terms of what we can do, the vision in terms of with the current peer networks in place, it's already been touched upon, but we've obviously the training you've offered and done with a lot of the schools, already the mental health leads. Again, just going to the point I probably made, where it was 2 hours ago, in terms of its reached the converse there, about what more can be done to engage those trusts. And if you are getting issues come back, I think it would be really important that perhaps our education team here know about that, because they've got those connections with those head teachers and trusts to see if there's a particular issue that we can obviously help as well, because it's all part of that joined up work, and you do that with your colleagues as well, just because that's my concern. If there is a particular issue in certain schools, then not let servicing, because it's something that we can perhaps come over and sort while working together. We're really keen to do that. So we go to the recommendations we've got in front of us, which was to consider and comment on the information provided and determine whether any further information was required for the committee's consideration, which we've done in great detail. So my recommendation I'd like to add to that, top of all the actions we've already talked about that we'll come back on, is that as a committee we write to NHS England to obviously express our support for the work that's been done so far and thank for the funding that's been provided so far. However, we really would welcome additional funding, because it's clear we have got some areas in the county that haven't been at the same level of interaction with elsewhere, which is the funding we've had, and especially probably with the initial funding put in place, so Bassett Law and obviously Mansfield and Ashfield, and to tackle the health inequality agenda. So I want to get that letter to them to actually ask for that extra funding, and also that we'll copy that into all our MPs as well, so they can obviously take that forward in terms of the discussion they have in the what they'll do in the chamber while we still got one before the election. Is everyone okay with those recommendations? Okay, so if we'll have a show of hands, all in favour? Any against or abstentions? No, it's carried. So thank you very much, and also thank you for coming today, and especially to Lise and Carl. I know there's a lot going on at the moment in terms of we touched on this on the meeting about stress. You must be on your colleagues. Do appreciate the time you've taken today, and please pass on our thanks to your colleagues as well for what they're doing. Thank you very much. And what I'll do is have a short adjournment while we move around and everyone have a comfort break before we get the rest of the agenda. Thank you.
Ready to go, Nate?
Okay, thanks everyone. So we're on to item 5, which we brought to you today based on the revised health scrutiny regulation guidance that's come from the government. So going to hand over to Noel to take us through what that does to affect our terms of reference. Thank you.
Yes, indeed. Just very briefly, you'll have read the report and see what's within the changes that we're going to have to adopt. The key change, of course, is that we no longer have, as a health scrutiny committee, the formal right to make direct referrals to the Secretary of State for significant variations in health services. Rather, we we, in common with either individuals or other organisations, have the right to request that the Secretary of State intervene, and we would be a statutory consultee should the Secretary of State decide to intervene in those circumstances. Now, as a result, we will have to change the terms of reference to remove references to the right to referral. We also will have to tweak the overview and select committee procedure rules accordingly to reflect the new regulations. They are now in place. They came into effect on the 31st of January. One thing I just want to clarify on is that at paragraph 6 it refers to the monitoring officer having the power to make those changes, and that is correct. They wouldn't formally need to go to full council because their changes required in order for us to be up to date with national legislation. However, there will be at some point that going to full council as part perhaps of other reports to do with the wider scrutiny process. Thank you.
Okay, thanks, Noel. Steve, do you want to take one first?
Just at the outset, I'd like to point out that this is nobody's fault in this authority. This has been imposed from on high. And my only question would be, why? Why on earth change it? What perceived advantage will there be for anybody other than those possibly that want to get something through quickly without scrutiny, which I think is a little bit worrying. I view it very much as another attack on local government. And I've written down here, is this going to full council? And you've just answered that at number 6. But I have to say, if it's going to be reported to full council, then I think we should have the ability to have a full debate about it at full council, because I think we should be writing to the Secretary of State for Health and asking him what possible advantage is there from excluding health scrutiny committees all across the country from being able to make referrals for something that's concerning them with regards to structural changes. I cannot see any advantage other than there's going to be more power in the hands of the centre and not in local government. And that is all I've really got to say. These sort of things absolutely astound me, and I'm hoping that the next government, and I'm looking Councillor Welsh's way, will reverse this, because it's absolutely stupid.
Okay, thanks, Councillor. I mean, in terms of the change of process, I really first looked at you wonder why. Obviously, not having the direct ability to refer anymore does change the powers we have. Obviously, as well as other groups, we can still fill out this new form in terms of asking the Secretary of State for intervention there. From what I gather from looking at it, is to basically put more of a process in place that scrutinises with the reports and letting other bodies do it rather than just doing a direct referral to go through the criteria, which I'm assuming, and this is just assuming, is to try to filter out some malicious ones going straight forward from a committee on political grounds. But I personally agree with you that I think the powers shouldn't have been changed. I think it could have just been increased. The form was available for other bodies, but I agree with you that the change, it could be perhaps communicated better and given us a chance to, like I say, to make representations for this committee before it came to this point.
Yeah. I agree with you, but surely deciding whether something is done on a party political basis and vexatiously is a subjective thing.
Yeah, I agree.
Really can't be done subjectively by somebody from a different party. And quite frankly, this committee is an all-party committee, and that ought to be up to us to decide. And I grant you that there are some authorities where there's one party totally in control, but here I think we try and do things a little bit differently sometimes. And I just think that someone somewhere ought to speak. You can bet your bottom dollar it won't be the Secretary of State that looks at it. It'll be a load of unelected civil servants, as is always the case. Thank you.
Yeah, welcome back, Councillor Welsh. You want to go?
Yeah, I feel quite. Well, I'm very dissatisfied to say with this. Firstly, I think there should have been a bit of a review into this, because we can speculate, can't we, of what has gone straight to a minister and what hasn't got straight to minister. What we don't need to speculate is our own experience here in Nottinghamshire. And I can think of two in the time from either working here or being an elected member that have had a significant impact that this committee has had in Nottinghamshire. A significant impact. I think it's a dereliction of duty by this government with what they're doing. I think when services are not challenged or questioned by scrutiny committees and having that power, terrible things are missed. And we've seen that. We've got proof of that. And I think it sets a dangerous precedent. I really do. I think it takes local democratic accountability out of the equation, and I think that is dangerous. And we've seen in Nottinghamshire how dangerous that can be. And I'm appalled. I really, really am appalled. I feel passionately about scrutiny. I really, really do. For many of the reasons that you'll be sat there, Councillor Wheeler, and I know that you will feel passionately about it too, particularly with health, because there is no other body in Nottinghamshire that questions what is going on in our health service. We have Health Watch, but there is no democratic accountability for them, for our health services that exists in Nottinghamshire. And to take away that bit of power that we have will be to the detriment of people in Nottinghamshire and the detriment to our health services. I firmly believe that. So I'm fundamentally against what this has happened, and I think it should go to full council. But I think as a matter of urgency, I think this, because it's a substantive change to our constitution, it's a substantive change to what we can do with scrutiny, FX overview scrutiny and health scrutiny. I think we need to make sure that all members are aware of this as a matter of urgency, of what these changes are. I really, really do, because, and I think we should be asking for some comeback on this. I know the decision is already made and the ship has perhaps sailed, but I do think all members need to be aware of these changes and the impact that they will have. And I think we need to strategically think about how, as a health scrutiny committee, we actually ensure that, although we've not got this power, we still find a way to use it.
Yeah, thank you, Councillor Welsh, for that. I mean, in terms of looking at the social day, I mean, I again agree with a lot of points you made there, same with Councillor Carr, in terms of the importance this committee has, and I can assure you, while I'm still chairman of it, we will still be doing the same level of scrutiny we have been and what yourselves have been doing before I was sat in this chair, because we still have the same powers as you see on the report too. Some people are here to be scrutinised. It's just about in terms of that extra power we have in terms of the direct referral Secretary of State, which we are losing directly. You can go for the indirect process, which is in place for the other bodies as well. In terms of this, again, full council, so I can't directly comment on that. Looking at the constitution and what goes where, kind of that be for the business manager to take forward the monetary office, etc., to what goes through the full council itself. But I do agree in terms of we could effectively send a letter to the secretary just asking for more clarification as to why the rationale was made, so that as a committee we actually have that full feedback. Then it'll be up to ourselves here to decide if further actions. I think that's first of all, rather than going straight away into the job they're going, which I'm sure we'd all like to do, and say X, Y, Z, ask for the full rationale and just express about some of the successes that we have had as a committee, and that's why we're asking that, and just to understand that process. So if people are in agreement with that, I think that's probably the best approach I would suggest first of all. Councillor Clark?
Make a recommendation, and hopefully I'll get a second, that we actually ask the monitoring officer, because it's within her gift, if you like, to actually not change the constitution until it's been debated at full council, which will be March the 21st, because we can't do it next week, can we?
Okay,
Is that
just for that,
possible?
I'll just bring Nolan first from a procedural point of view, just to check on that one first of all. If it's found a recommendation.
What I can do is have a conversation with the monitoring officer on the basis of the discussion we've had today. But what the monitoring officer will be anxious to do is to ensure that our constitution reflects current legislation and to effect those changes to the constitution within the powers that the full council has delegated to her already. So she is in possession of those powers. Not the power, the delegation to act, and I can certainly take away what you've said, but I don't think it would be appropriate for health scrutiny to make a recommendation of that phrased in that way. Councillor Carr. That's my
Democratic Services. First of all, if we get that conversation along our Chelsea, which Noel will have, and can we get back to you in terms of the correct process? I mean, that, as Noel's quite said, we've got to be correct process. Then we can discuss next steps from there. So, that was an agreement. Let's just go to the secretary to. Sorry, I'm going to ring Sarah in a moment before I get to that point. Sarah, sorry.
Yeah, I think I've tried to read this because Health Watch is specifically mentioned as one of the organisations in the guidance that can now ask for a call-in around reconfiguration. So, trying to understand what new responsibilities or areas of influence that my organisation has, for instance. And what it seems to me when I've read into it is that this is very much around the Integrated Care Board, the Integrated Care System, looking at how that is reconfiguring, and where any agency, if you like, is not happy with those reconfigurations, they can now go to the Secretary of State directly. I believe in scrutiny, I believe in this panel, I believe that this is a really useful process, and I think anything that erodes that sense of scrutiny from an elected member's perspective would be undermining what I think has been and should be the checks and balances that are there on a system that is, which you as local elected members are part of, and being able to sort of hold to account in that way, I think is really important. So I think for me, having read some of it, I feel there's a lot more to really unpick as to what it's about. So any request for further clarity, I think, would be really useful, and what the change actually means, because I think there's still the ability to bring the Secretary of State in. It's just that direct link looks like it's gone, but there's now further powers for others to do that. So I think it would be really helpful to get that level of clarity. Speaking of one of the stakeholders that's involved in it.
Thank you for your input there. So, Michelle, do you have a quick one for please?
Yeah, just to say, you can give other people power without taking power away from this Health Scrutiny Committee, and I think that's my point, and that's what I said. There's nothing wrong with Health Watch being able to make that and do that because without taking that. And I will have to say, there was a lot of people that knew about the maternity issues, and it took people a long time to speak up about it. And if it wasn't for this committee and the previous chair as well speaking up about it, I don't think those changes meant. And that is my exact point that I'm trying to make. The largest maternity scandal in NHS history, and it was this committee that spoke up about it. That is my point. That's what worries me, and that's why I think we need to do exactly what you said. Totally agree that Health Watch should have that power to do it as well, but I don't think that should be the expense of us having the direct contact here.
Okay, thank you. So, again, Councillor Adams, do you have a point? Sorry. No. Okay, so I thought I put your hand up. All right, okay. What do you say? My new glasses prescription works perfectly then. Okay, that's fine. Yeah. Yeah. So thank you for everyone's contribution. I think we're on the same page then. So we'll send the letter to just ask for clarification first of all in terms of the rationale why, and then we can discuss as a committee and decide in further steps. But to reinforce what I've already said, nothing will change in terms of the level of scrutiny we give to bodies that we summon to come in here, which we still have that power to. If we do feel there needs to be a referral in place, we do have that new form, but also if whatever it comes to, if it means we pick up the phone or going down to London to speak to Secretary of State to get that intervention, that's what I will do. And we'll still, whatever we need to do to make our point go across, we'll still do with all the mechanisms we have available to us. So I want that to be absolutely clear. There's no diminishing of our responsibility and our powers from my point of view from there. One is to change procedure, which if that doesn't change still means we will still get the outcomes we need. We may just have to go a slightly different way around to get there. So if everyone's agreeing that the recommendation, we'll just add that into the recommendations. All in favour? And that's unanimous. Thank you very much. So, nearly there. Work programme. So, first of all, thank you to Noel for the work he's done, obviously, conjunction myself and Bethan to try to reorganise the work programme to make it current and obviously sort out a bit more just to put some more recommendations in terms of it. And it's got you in front of it now. Before I ramble on, bring Noel, if you want to just talk about a couple of bits on there.
Yes, I'm afraid it is still not the finished article, and we do have a couple of variables, items coming down the pike, as it were, which we're not quite yet in the position to schedule, but we'll have to in the near future. That would include Newark Urgent Treatment Centre and tomorrow's NUH, but we're not quite in a position to be able to drop those into the where we need to do. So I still, I'm afraid, it seems to be something I keep saying. I still have more work to do to firm this. So we will be revisiting this at the first full meeting, obviously, of 2024-25. So in the June meeting. But what I have included in there are some comments on some very long-standing issues that there are suggestions within the appendix as to how we deal with those, either to drop them or to provide briefing and sort of move those along. But do please continue to bear with us. We want it to be fuller than it is.
Okay, a couple of points on there in terms of a briefing though. The reason we put those in there is first of all to give that to, and then for members of the committee to decide if they think that covers what we wanted to cover, or there might be if they're down the line. What I don't want is just to have that item on time which we could cover in it's more of a point of information rather than to fully scrutinise. Also, there's comments against all the items on there, and this is not trying to take them off for no reason, as the comments say in there. There are some items which we either have to refocus or have been scrutinised in another forum, such as the Health and Wellbeing Board. And so, given the amount of items that are on our agenda and a couple we've just added today, it's about prioritising those which we can get the most impact of, bring forward into the committee, and obviously time-sensitive ones as well. Give an example: in York Hospital, obviously we are dependent on when the ICB make their decision before we can scrutinise it further. Giving an example there. Does anyone have any comments on in front of you, Councillor Carr?
Yeah, I actually wanted to bring a possible new subject forward, if that's okay. Something that's come to light and actually worried me, not just from a personal basis, but for other people that may be affected by this. 3 weeks ago, myself and my wife contracted COVID, and even though I've had every single booster that's going, and I'm entitled to every single booster because my wife is immunosuppressant, this is the third time that we've had COVID, and this time it was the real deal. It wasn't pleasant at all. Before, because my wife is immunosuppressed, when she develops COVID and she tests positive on a lateral flow test, she has to go for intravenous drip of antibodies and antiviral drugs because potentially her immune system can't cope with it. And the time that she'd been for, she went to the City Hospital in Nottingham, a unit there that was away from all the other hospital facilities. This time, I had to drive her with COVID, feeling ill, to Mansfield, to Kings Mill, because the NUH had closed their facility down. So basically, the whole of Nottinghamshire, anybody that's recovering from cancer treatment, anybody that's immunosuppressed, cannot go anywhere in the Greater Nottingham area to receive this vital infusion, and they have to make their way to Mansfield. and I think that is just something that strikes me as being a terrible service and something that clearly hasn't been thought through on a how would you say it, a grander scheme as to whether it's right for somebody who's got COVID to take somebody with COVID 20 miles away to walk through an NHS emergency department, which he had to do with COVID, to get this treatment. And I just think that this really does need to be looked at actually quite urgently, because COVID, believe it or not, is on the rise again, and the hospitals are full of beds with people with COVID again. Thank you.
In fact, I mean, I think first of all, obviously, hopefully, your wife's feeling better now, and I know it's gone round. I think both Noel and Beth to my side have had it, so I might as well escape it this time round. So I know it's going back round again. Yeah, yeah, exactly on that one there. So I think first of all, I think we've just clarifying the procedure of the ICB. So we've probably taken notes, and we've got notes here just to clarify what the actual process is to make sure we're correct and that signposting correct. So if we get that around to members first, and if we feel like from there, once scrutinised that, bring ICB in, we can do that. Will that be all right? No, I think it's definitely an important point to raise. So let's get that clarification of procedures, then see from there if we add an item. Is that okay? So Michelle, was that point came across as well?
Yeah, there's two things that I've been alerted to recently. One is measles in Nottinghamshire is on the rise. I know all schools had an email this morning with regards to it. The uptake of MMR, I think I've said that wrong, but the vaccinations has dropped considerably in the country. And Nottinghamshire was always seemed to be okay, but actually over the last six months it's dropped considerably, and we've seen measles in our schools in every area of Nottinghamshire. Not in every, but across Nottinghamshire. It's not just in one particular area. And I know the ICB are doing some work on it, but I think perhaps that's something we may need to have a conversation with or look into with regards to measles in our schools, the vaccination rates or something. There is something there, I think, that we need to look at. Councillor Wheeler, you might want to have a conversation about what is best to look at, but there is definitely something there if the email's gone out to every school today. And the other thing is I wanted to raise, because I said that I would raise it, is with regards to mental health situation in Nottinghamshire particularly, and notwithstanding that women aren't affected, but I've been asked to raise it with regards to young men in particular. I mentioned Ollerton, the suicide rates in the last 18 months of 7 young men that's triggered something in government, but unfortunately it hasn't triggered any additional funding. And a meeting that I had with the National Farmers Union as well, which has said that mental health amongst young farmers in general is actually on the rise as well, and Nottinghamshire is not immune to that. So mental health in our rural communities as well, I think we need to look at that as a matter of urgency.
So yeah, I think in terms of mental health for itself, no, we have sort of touched upon it in the work programme itself. Then I think I discussed it last time when we talked about the mental health item, but we were going to bring forward today. So if we take away and look at that, how we can best define that in terms of a scrutiny item that we can bring forward. I think we'll have this conversation with the ICB and come back to you. Hopefully we can add something together.
Councillor Wheeler, the National Farmers Union locally, Andy Guy would be very keen to have that conversation with you with regards to how it's affecting the rural community.
Yeah, okay, we'll get that looked into how we can put that together. Thank you very much. Any other comments on the work programme itself? No? Okay, so thank you very much for that one. So we will take that away, those items, and get that all put in, and on those actions that have been put forward by Noel there, we'll take forward as well. So we'll take a vote now if we're all in favour for the work programme. That's fine, thank you very much. And that's it then. So thank you. I know it's been a long morning, but I think really productive morning. Been lots achieved this morning. So thank you very much, everyone. I look forward to seeing you next month and to let the meeting close. Thank you.